Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Today on Community Health Heroes, we'll be focusing on some important health issues for seniors in our area. First, we'll be speaking with Dr. Ricardo Febry, founder of Internal Medicine Consultants, LLC. He has some of the latest information about Alzheimer's and dementia and how seniors can spot the symptoms and ways to prevent and treat the disease. We also two-stepped our way into a line dancing class at the Ochsner Fitness Center in Harahan. You'll find out how local seniors are staying active and how exercise is keeping their minds sharp and in shape. The executive director of the New Orleans Council on Aging, Howard L. Rodgers III, will also be stopping by to talk about nursing homes in New Orleans and how his organization is helping seniors in our area. And Brad Grundmeyer, Vice President of Marketing and Community Outreach for UnitedHealthcare Community Plan of Louisiana, will tell us about the generous donation UnitedHealthcare has provided to Louisianans, including a $250,000 donation for flood relief efforts in South Louisiana. Last, we'll be sampling some brain food in our Eat Fit NOLA cooking segment. We'll be in the kitchen with Gia Dileo of Green to Go and Eat Fit Ambassador Emily Eickhoff. Green to Go specializes in using organically grown, locally sourced, and fresh ingredients. They'll prepare salmon and rice with ponzu to help seniors and everyone stay on top of their physical and mental game. So don't go away. We'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Community Health Heroes. Did you know that Alzheimer's disease is the 6th leading cause of death in the United States and that more than 5 million Americans are currently living with Alzheimer's? By the year 2050, that number is expected to reach 16 million. With us to discuss the latest breakthroughs about this debilitating disease is Dr. Ricardo Febry with Internal Medicine Consultants, LLC. Thank you for joining us today.
Thank you for inviting me. It's a pleasure to be here with you today.
Oh, you too, and especially we're going to talk about, an issue that affects so many of our older loved ones. Can you first tell us exactly what is Alzheimer's disease?
Well, it's a type of dementia. It's like there are several syndromes that lead to the loss of memory and cognitive function, and Alzheimer's disease is probably the leading one. 60 to 80% of dementia cases are related to Alzheimer's in particular.
What are some of the signs or symptoms of Alzheimer's? What should you be looking out for?
Oh, loss of functional capacity, very basic functional capacity, things like not being able to balance your checkbook, reacting inappropriately to an unexpected life event, having difficulty finding your way in a familiar environment. And the most important one, and the one that you most commonly seen first, is loss of memory of recent events.
We've all heard of early onset Alzheimer's. I think a lot of us feel guilty sometimes thinking we have it because we're so stressed and forgetful. But what exactly is early onset Alzheimer's, and how early can it start?
Anything between the ages of 18 and 65 falls under the category of early onset.
18?
Yes, but fortunately it's only a very, very small segment of the cohort of people that suffer dementia.
I guess those cases, when you see them, are sort of the more tragic ones because you start so young.
Absolutely. However, you also have to approach it diagnostically in a different way than you would someone who is over age 65, because you don't want to miss a treatable cause of the cognitive loss in function. It's a tragic event.
Let's talk genetics. If your grandmother or grandfather have Alzheimer's, does that mean you're guaranteed to get it one day?
There's a very, very good chance. We always have paired genes, and in a dominant inheritance pattern, only one of those genes has to be present, and it pretty much guarantees you with 100% certainty that you are going to develop the disease.
Well, can it be preventable at all? I mean, is there anything you can do, any foods you can eat? And you always hear about, doing puzzles or crosswords, that might help. Is any of that true?
Does that prevent the progression or the onset of the disease? There's really no data to support that. Having said that, in absence of anything else that we can offer people, we do encourage, because of that correlation, lower risk associated with higher physical activity, leads us to make that recommendation that in your midlife, in your mid-age, stay as active as you can, stimulate your brain as much as you can, maintain social interactions for as long as you can, and hope that correlation helps delay or maybe even prevent.
Let's talk about your practice, IMC. What do you offer patients with Alzheimer's or dementia?
What we have done in our practice is we have identified a need for a segment of the population that is over 80 years old, that is frail and debilitated, and therefore considered homebound. And by that definition, they're also having difficulty accessing healthcare services. And so we have identified that need as one that we could serve probably better than the traditional medical practice model, because our force is a mobile force. So we have nurse practitioners that go into the homes of these patients that trust us with their care, and we basically take over their care as primary care physicians.
If people would like to find out some more information or find out about more resources in our area, where can they go?
I recommend the Alzheimer's Association website. It's a national association that has very, very good resources. The website address is alz.org, www.alz.org. And in that website, you'll have a contact number that is a helpline 24 hours a day, 7 days a week. And then the website itself, if they are enabled, if they have the ability to navigate in the internet, it's full of links to very, very good information. So that would be my starting point.
Well, thank you so much for joining us today and telling us such great information about Alzheimer's and dementia.
Thank you for having me. It's been a pleasure.
When we return, we'll have a Community Health Heroes report on how seniors can exercise their body and their brain, what help is available to local seniors through the New Orleans Council on Aging, and an update from the Vice President of Marketing and Community Outreach for UnitedHealthcare Community Plan of Louisiana. Don't go away. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know leading a physically active lifestyle can have a significant impact on the physical and mental health of those with dementia and may improve the quality of life for people in all stages of the condition? In recognition of World Alzheimer's Month, I was invited to a line dancing class where local seniors are doing their best to stomp out the threat of dementia and Alzheimer's with knee pops, heel grinds, and scissor steps, strutting their stuff to a syncopated tune. It's hard to believe, but Angie Pendergrass is 79 years old. At the Ochsner Fitness Center in Elmwood, she performs a series of weaves and pivots, hip bumps, and toe slides. She's also making sweeping changes when it comes to her health.
It really helps me out because it's a lot of exercise. And I think the more exercise we get, I think the better off we are, especially when we get our age.
According to multiple studies, physical exercise can prevent and reduce the risk of developing Alzheimer's disease and other kinds of dementia. And the Alzheimer's Society finds exercise improves cognition and memory and can slow down mental decline.
I don't have to stop and think about what I'm going to say. I do not forget anything, as far as being cognitive, and I read lots and lots of articles. I read lots of books. And I really do believe that if you keep your mind active, I think that, your mind will stay active. I have more energy, I eat healthy, I can sleep better, and, and that's really the benefits that I get from it. Exercise is the key to health.
Linda Bienvenu, a senior aerobic line dance instructor at Ochsner Fitness Center, has been teaching dancing to seniors for more than 23 years. She said as many as 80 seniors fill her beginner, intermediate, and advanced classes every week.
It's Very good exercise, line dancing. I think it's one of the best things besides running and swimming, for seniors, because they can move and they don't have to do the exact dances and steps that I'm doing. They can mess up and it doesn't matter. They're moving, and that's the main thing, getting their circulation going. It's good for their memory because they have to memorize the different patterns because every dance is different, and we know so many dances. It's well over 500 that I know that I've been teaching.
The Bienvenue's award-winning team of Ochsner Sassy Steppers compete and perform throughout the region. The group is pretty social, and they even take cruises together.
The benefits are just unbelievable. It helps with circulation, balance, and memory. That's the main thing. They amaze me, these seniors that can get up, memorize these dances, go out in public and dance and have fun, never skip a beat. It's really fun. And it's rewarding to see them learn, and have fun when they go out and dance.
The exercise is wonderful. It's been wonderful for me for the past 5 years here. I've been line dancing 5 years, and I love it. I really do. I wouldn't trade it for anything else.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Did you know the number of Americans aged 65 and older will double from about 46 million today to more than 98 million by the year 2060? That means our next guest and his organization will be very busy in the years to come. Joining us now is Howard L. Rodgers III, Executive Director of the New Orleans Council on Aging. Thank you for joining us, Howard.
Thank you for inviting me.
When it comes time for seniors to look for a nursing home, what kind of help can they get from your organization?
Well, from the New Orleans Council on Aging, what we usually do is if an individual calls in and has a question about a nursing home, we will, number one, give them a list of the available nursing homes in the New Orleans area. And then we don't give a personal opinion on those nursing homes, but we ask them to check with each individual nursing home. And you want to make sure that where you place your loved one, that they're getting the best possible care that's afforded to them.
You mentioned that you give people some of the options out there, but how affordable are nursing homes? Is there a range you can give us?
Well, usually on the average, nursing home placement is, I want to say roughly around $13, $14, maybe even up to $2,000 a month. So it depends upon the individuals and their ability to pay. In fact, that ability to pay also comes into play when an individual applies for Medicaid to supplement them going to a nursing home.
When should families start looking for nursing homes for their older loved ones?
That's a tough question. And you could say, all right, I'm going to put my mother or my father in a nursing home 5 years from now because I see them slowly coming to the point where they can't take care of themselves. So it's going to be left up to the individual family caregiver to make that determination. You could, if you want to project 5 years into the future, then start trying to rearrange their assets so that the individual would be declared eligible for Medicaid at that point in time.
Let's say you're not quite ready to go to a nursing home. I know the New Orleans Council on Aging provides a program called Homemaker. Could you tell us a little about that?
Well, the Homemaker services that we provide provides assistance for an individual who is homebound or who needs some assistance at home. Now, the Homemaker program is a light housekeeping. Actually, the homemakers are seniors themselves. The majority of the homemakers are over 60, and they'll go in and they'll do a little light dusting, maybe mopping, sweeping, cleaning the blinds, vacuuming the floor, cleaning the bathroom.
Well, all that helps,
yeah,
right?
And that helps. And they might even prepare a light meal for the individual. And that's to the extent of our homemaking services.
How about senior centers in our area? There are a lot of them, right? And what type of services could they provide seniors?
Well, we have, in Orleans Parish, we have 15 senior citizen centers, and they range in types of activities that they have. We have some that have supported services embedded in the center, for instance, Kingsley House is one that has also an adult daycare component to it. And in that particular instances, what would happen is an individual who would come into the senior center usually to receive senior center services that all the centers operate, a hot meal, some daily activities such as exercise, or maybe some other type of activities such as foreign languages or computer classes. But then if you have an adult daycare component, they have a medical model where they track the individual with a nurse and also a social worker. And they also put them on a restricted diet. And this is for individuals who might have some medical problem who need specific care and attention. But as for the senior centers, there's a range of activities in all of the senior centers. Some of them have line dancing classes, some of them don't. Some of them either teach Tai Chi, and I understand that one senior center is in the process of starting to teach Taekwondo.
Wow, that sounds like a happening place.
Yes, it does. It does. In fact, I think I might go by and take a few lessons in self-defense myself.
Well, tell us, how can our audience get in touch with the New Orleans Council on Aging?
They can contact us at 821-4121, which is our number. We're located at 2475 Canal Street. They can also look us up on our website at www.nocoa.org. That's New Orleans Council on Aging.org. Or they can visit our Facebook page as the New Orleans Council on Aging.
Well, thank you so much for stopping by, and congratulations on all the great work you guys do for seniors.
Well, thank you very much for inviting me to be on your program today, and I hope I've been able to give you some vital information to share with your studio audience.
You definitely have. Thank you.
You're welcome.
Up next, we'll hear some exciting news from the VP of Marketing and Community Outreach for UnitedHealthcare Community Plan. And our studio will start heating up with our Eat Fit NOLA segment with a salmon dish you don't want to miss.
It takes less than 1 minute to find out if you may have prediabetes. You can do it here. But I get it, you're busy, and busy people can't have prediabetes. I read that wrong. They can, okay? Just go to the site.
Joining us now is Brad Grundmeyer, Vice President of Marketing and Community Outreach for UnitedHealthcare Community Plan of Louisiana. Brad is here to give us an update on the plan's work and some of the generous donations UHC Community and State has made over the past year. Thank you so much, Brad, for stopping by today.
Thanks, Leslie.
So tell us a little about the UnitedHealthcare Community Plan of Louisiana. What exactly does it do, and what do you do there?
Absolutely. UnitedHealthcare has a community plan, so that basically is our Medicaid product, but also just recently it's more of our Medicaid expansion population. So for UnitedHealthcare, we have over 435,000 members throughout the entire state of Louisiana who are currently on Medicaid. We're one of 5 plans that are represented with the Louisiana Department of Health under Healthy Louisiana. And just recently, as I mentioned, the Medicaid expansion, we've been able to grow about 125,000 members just for United alone, but well over 450,000 members statewide now have Medicaid benefits. And so it's fantastic now. More people are being covered, more people are out of danger, if you will, and getting the kind of care that they need.
There's been a lot of flooding recently. What has your organization done to help people in need who are trying to recover from floods?
United, of course, being that we're statewide, but that we always kind of put our money, I guess I should say, where our heart is, and that's in the area of our communities that we serve. And so immediately we were able to get over 5,000 care packages out to those communities. But also what I think is most important is we as UnitedHealthcare were able to give $250,000 to the Baton Rouge Area Foundation.
Nonprofits always are struggling for resources. I know you guys are doing something special with the computer program.
Yes, we do. What we do is we have our own laptops that we have nationwide, that the company, I should say worldwide, and we take them off the market, if you will, out of the hands of our employees, refurbish them, and then we give them back to the community. So in Louisiana alone, we've been able to donate well over 400 computers to nonprofits that might need it just to help the seniors come into their facilities and learn how to use a computer or educate kids on how to use a computer. So whatever the organization is needing a computer, we have an application process, people sign up, and we're able to give them these refurbished computers.
That sounds like such a great gift because...
It is. It's kind of, the whole recycling aspect is what I think we all should, instead of just throwing it away or putting it on a shelf, we're able to kind of give it back into the community.
I know you enjoy very successful relationships with 4-H.
Yes.
Tell me about what you guys are doing with 4-H in Louisiana.
Well, when you talk about, particularly on the Medicaid side, kids that don't have access to quality foods, food deserts, and the lack of education regarding what is a good quality food and what is the best food for my kids should be having. We with 4-H have committed well over $5 million. Just recently had a $1 million commitment again to extend our partnership with that organization. And it's fantastic because it's statewide. Here in Louisiana alone, this particular run, we've given $60,000 to the Food Smart families. So what we're able to do is do a couple of things. A, teach teenagers how they can go be ambassadors for this program and go and teach and educate young people. We can educate families as to how they and what they should be giving their children. We also have distributed well over 25,000 of these food bags to families. And lastly, we're able to provide like 26,000 families just and growing opportunities. How do they apply for SNAP? How do they apply for federal programs that might be able to assist them? So this $1 million recommitment is just our effort of saying that we are local, we're here in Louisiana, and we're trying to make a difference to help our community grow.
Well, it sounds like you're doing an enormous amount of work. Tell us, how can our audience learn more about UnitedHealthcare Community Plan?
Absolutely. We have a great website full of information for our members or people who are interested in becoming a member, not just with Medicaid, but specifically for UnitedHealthcare. It's www.uhccommunityplan.com.
Great. Well, thank you so much for spending some time with us today and telling us about all the exciting developments.
Thank you, Leslie.
Thank you.
Appreciate it.
When we return, Gia Dileo with Green to Go and Eat Fit NOLA Ambassador Emily Eickhoff will prepare something yummy that's also good for the brain. So stay tuned for more Community Health Heroes.
Hi, I'm Molly Kimball, registered dietitian with Ochsner Fitness Center and with Eat Fit NOLA. We're a nonprofit initiative that works with local restaurants to highlight the better for you items right there on the menus. We now have over 180 partners, and that spans over 5 regions. So the Ochsner Eat Fit program has expanded beyond Eat Fit NOLA to Eat Fit Bayou, Eat Fit BR, Eat Fit North Shore, and beyond. We're honored that United Health Foundation and Community Health Heroes features Ochsner's Eat Fit program every month, shining a spotlight on one of our talented Eat Fit chefs, whipping up dishes for you that are nutritious and delicious. So don't go away. Community Health Heroes will be right back.
Joining us in the kitchen are Gia Dileo with Green to Go and Eat Fit NOLA Ambassador Emily Eickhoff. Welcome to the show, ladies.
Thanks for having us.
Yes. Today, we're focusing on senior health issues, so we knew Green to Go would be the best go-to restaurant to go to talk about what to eat for brain food. And it looks like you have some salmon you're going to prepare. What type of dish is this today?
This is actually a salmon, we call it a salad, a salmon salad with ponzu, which is a house-made sauce that I'm going to talk about, broccoli and onions on a bed of brown rice.
Is this ponzu sauce? It looks a little soy sauce. Is it related?
It is. We do. So it does have soy sauce in it. Low sodium. That's the key there. Low sodium soy sauce. And we use fresh squeezed juices. So fresh squeezed lime and lemon, mirin, and a touch of cayenne for a little bit of heat. And it makes a great topping. So what I'm going to do here is I'm going to go ahead and put our salmon in. And I've started by lightly marinating it in some avocado oil, which is fantastic for the omega-3s, which we're talking about today. And I'm sure Emily can jump in and talk about why omega-3s are so fantastic for our brain.
Yeah, omega-3s are really great for our brain. We have the olive oil as well, which are full of those heart and brain healthy fats. We really want to make sure to get those in our diets. Omega-3s are also great for inflammation. So if you have any kind of joint issues or anything like that, you want to make sure to get your omega-3s in.
And the inflammation also is helpful in this respect because inflammation on the brain is what we're trying to combat with Alzheimer's. Right. So some great examples, obviously salmon is one of the best that has omega-3 fatty acids. Also broccoli, which has a ton of vitamin C as well as calcium. And then what we've done here is I've also included some what could be breakfast items and or dessert items. You've got fresh berries.
These are huge.
Aren't those gorgeous? So blackberries, blueberries, some other ones that are a little hard to find or seasonal, cranberries and pomegranates are also really great to combat inflammation.
And of course, fish. I mean, you hear all your life fish is like the best brain food, right? But you think salmon's on the top of the heap when it comes to that?
I agree. Yeah,
I agree. I would say all cold water fish is your primary. So you're looking at herring, salmon, mackerel, those cold water fish, and obviously we're looking for wild caught, not farm raised.
And why would you say, if you were preparing this dish for seniors, why do you think seniors would gravitate towards this dish? Why would they like it?
I think because it's so flavorful. I mean, it's when you become, when you're elderly age, you might have some restrictions as far as what you can eat. I feel like salmon's a really great option. It's not too tough. You don't have to really cut it. You can use a fork. It's a little bit softer.
It's not an overly fishy fish.
It's not very fishy, yeah. And so, and all around great, high protein, low in calories, but really great.
Yeah, I was about to ask about that. What's the calorie count of this?
Yeah, on this whole dish, it's about 400, 450 calories, but there is not one empty calorie in this whole dish. It's, your complex carbohydrates with the broccoli, your high protein, high fat with the salmon. So you're not, there's no guilt here, with that.
And one of the things that I like about this dish particularly, especially for seniors, it really is a one-pot dish. So you can cook your salmon, you can cook your onions and your broccoli all in the same pot. And then if you have a rice cooker, which I love, brown rice, throw it in, set the timer and go. You don't even have to think about it. So it is, in terms of simplicity, this is really high on the list of simplicity.
So it really just took this amount of time to make this dish?
That's it. And then if you wanted to throw in afterwards, oh yeah, really quick, your onions, your vegetable, your broccoli, and if you wanted different vegetables, if you want carrots, if you like other types of vegetables, use other types of vegetables. This is the one that I like. I think the flavor profiles go really well together. And it also, if you look at the plate, and this is what we're looking for, you see lots of color. So you've got brown, you've got green, you've got pink. So what you're really looking for in your diet, and this is really easy for seniors to remember, as much color as you can get in your diet, the better.
Yeah.
And tell me about the relationship between Eat Fit NOLA and Green to Go.
Yeah, several years of close-knit relationship. Gia has been there for us at every event, home and garden show, any kind of demo here, and it's just been great. I mean, our partnership has definitely evolved to more than what it was when we started 3 or 4 years ago.
Absolutely, and to see the evolution of Eat Fit and how well it's taken off, not just in New
Orleans,
it
everywhere,
but all of Louisiana is amazing. And I think we're one of the more unique restaurants that it's not just one item from our menu, like a lot of restaurants that maybe just be 1 or 2 items that qualify for Eat Fit. At Green to Go, the bulk of our menu is Eat Fit approved.
Yeah,
and it's always a great option. Like anyone anywhere in the city can really go to Green to Go because you have that. The location is nearly everywhere.
Uptown, downtown.
So you can see your Eat Fit NOLA labels on a lot of the food.
Yeah, and even you sell your own salad dressings, so even some of your salad dressings are Eat Fit, and you can see that in the store.
So that's it. So you just whatever vegetables you make, you put in, and it looks just like this.
And it comes out just like this.
So how can our audience find out more information about Green to Go?
They can go to our website at greentogonola.com. They can also find us on all social media platforms, Green to Go NOLA, Twitter, Facebook, Instagram. And the Instagram is actually my favorite because the pictures are phenomenal.
I can imagine with all the colors. Yes. Well, thank you both so much for joining us today. And of course, we'll feature your recipe on our website at communityhealthheroes.org. And we'll be back right after this.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org, and you can also find our show on YouTube. We hope the information we provided on important senior issues will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.